Finally be easier to schedule a COVID-19 vaccine appointment, but a lot of that depends on where you live. Madeline O'Neill breaks down the differences between the vaccine supply and demand county to county and what trend many vaccinators are seeing for the first time.
In the beginning, appointments filled quickly. Demand looked endless.
Iowa County, every drop we get is going in an arm.
Supply was harder to come by.
We seem to have more demand than we have vaccine at this point.
Iowa County Emergency Management Director Keith Hurlburt says with small vaccine allotments that are just getting smaller, they're not having problems filling appointments.
I just know that counties around us have had a tougher time lately to fill all of their slots.
Vaccinations look different in Dane County compared to surrounding counties, and a lot of that boils down to vaccine supply and demand.
Wisconsin is one of the top states in terms of how efficient we are in putting shots in arms.
Once the #1 state in the country, now dropping slightly to 6th in the latest rankings, with about 87% of vaccines administered. But demand isn't level across the state. SSM Health's vaccination clinics fill more quickly in Dane County than Sauk or Rock.
The demand for the vaccine in Dane County continues to be very, very strong, a lot stronger than what we're seeing in the other counties.
State numbers show 54% of Dane County residents have gotten at least one shot, rising well above the state's total of 41%.
Perhaps because we're not seeing the same level of hesitancy in Madison and in Dane County, and perhaps because access is also not a big problem.
Counties such as Rock, Dodge, and Jefferson are falling below.
Maybe have 3 or 4 people signing up each day, as opposed to the hundreds and thousands that we're registering in the first few weeks, and we're having a lot of trouble filling those appointments.
Samrose Jacquevani with the Jefferson County Health Department says that could be driven by county differences, especially between urban and rural areas.
Some of it comes down to access, some of it comes down to lifestyles and personal sort of beliefs that folks have.
If needed, the county can list extra appointments on the state registry for anyone and get creative to get end-of-day doses to its residents.
We'll do anything. We'll walk around the parking lot of the mall and ask folks if they're willing to get vaccinated.
A number of counties got back to us, including Grant, Marquette, and Green Lake, saying interest is starting to dry up some. Now, even in Dane County.
We're seeing starting it to level off a little bit.
According to Public Health Madison and Dane County, this is the first week appointments haven't filled quickly.
In Wisconsin, we're vaccinating really quickly, which is very exciting, but that also means that the demand will eventually start to dry up.
That will call for a bigger push to bring the vaccine to people rather than people seeking it out.
It is very important that we all get the vaccine, and it doesn't really matter when it comes to which county we live or work.
Because the virus doesn't care about county lines.
If we have 100% vaccine take up here in Iowa County and we only have 50% around the rest of the state, we didn't do any good.
In Iowa County.
Because we're not all going to stay in Iowa County for the rest of our lives.
Madeline O'Neill, News 3 Now.
According to the Department of Health Services, on the rare occasion that counties have leftover vaccine, they are encouraged to use it in a community clinic.
Well, many counties and vaccinators have open vaccination slots this week, and we have a comprehensive story on our website with links to setting up those appointments.
And here's Chief Meteorologist